Okay, good afternoon. I was asked to discuss the topic of monkeypox. It's a brewing topic currently, and I think is relevant for many different situations. So, we may classify monkeypox as an re-emerging infection when we talk about it from the health context. Although it is not a new situation, it is new for the world outside of most countries in Africa. And I think this disease particularly underscores that ongoing disease patterns that we are seeing increasingly among us. We are on the heels of another pandemic right now, which is SARS-CoV-2. And now there's a hemorrhagic virus, which I have listed here. But, there's other situations, if you go back just the last decade alone, that have a specific link to animal health and trying to bring that pattern into One Health, because animal and human health are closely interconnected. When you look at H1N1 and what we initially had labeled as a swine flu, and then you have had elements of bird flu, SARS a decade ago, and then MERS with cases mostly confined to Middle East countries, the Ebola hemorrhagic situation, which had cases outside of Africa. You recall Zika, chikungunya 5, 6, 7 years ago. SARS-CoV-2, which we are into year 3 now of the pandemic. Monkeypox, which was just declared a public health situation of concern 3 days ago. And of course now 2 cases of Marburg virus in Ghana, which will require closer monitoring of the situation there. So all these diseases, which are now prevalent in some aspects of human societies, have all made that bridge, if you will, from animal hosts and the link that they have of animal health to human health. You're going back to basic biology of monkeypox, where it comes from. It's a viral zoonotic disease. It's not new. It is new for the world outside of Africa. It's caused by the monkeypox virus, and it's a member of the orthopox virus, with 2 distinct clades, with the West African one and the Congo Basin / Central African one, with the West African clade being classified as less severe than the Congo Basin / Central African one. Prior to April 2022, infection in humans had been rarely reported out of the African continent, where in some places it would have been considered to have been endemic. But of course, with globalization, with the close connection that animals now have with humans, or I should say humans with animals, because it's us humans going into the environment of encroaching into environments of different animal species. This can only be anticipated we're going to be more and more exposed to situations such as the monkeypox virus. Cases are occurring worldwide. I have some data on that in a couple of slides. And as I said, Saturday, WHO went on to classify it as a public health emergency of international concern. I was just reading some of the notes on it yesterday. Some infectology societies are considering that this may have been a little bit too premature. Some other societies are considering that it's perhaps a little bit late, given the increasing number of cases. And just to highlight why diseases like this will continue to, or can continue to increase in different elements, is because you look at this data out of Nigeria, making the comparison from 1970 to 2018, as you have a decreasing vaccinated population, and we are talking about vaccination for smallpox, how that would have covered you to a certain degree. But as the years go by, as immunity wanes, and if you have increased urbanization, increased contact with animal hosts, your risk of monkeypox and other similar viruses can potentially and will potentially increase. The current data, more than 18,000 cases now in 75 countries, with 69 of these countries had not previously been reporting cases traditionally. And we're talking about a history of more than 50 years, because the first case in a human was documented back in 1970 in the now Democratic Republic of Congo, formerly Zaire. And as I said, the vast amount of these cases are in countries that had previously not reported cases. The first outbreak outside of Africa was almost 20 years ago in the US, and it was through US infected prairie dog pets that had had some contact with wild species, and you can trace it back to Africa, the African continent. Some countries may have had reported sporadic cases, but which were related to travel or exposure to animals or pets that may have been wild pets that may have been brought from Africa, but not the ongoing transmission that we are now seeing in several countries as listed here. Closest cases to us, Mexico and the US. Mexico has more than 60 cases, the US more than 3,000, I believe now. And the other countries that are closer to us geographically, Costa Rica and Panama having reported one single case. And this is the data up until yesterday. If you see the increasing number, particularly in the last month, and we look at the specific populations that are harboring this virus right now. The transmission is always going to come as a result of close contact with an infected animal species, which we may not be aware that that species has monkeypox. It might not necessarily be an unhealthy animal. It can even be in, rodents, non-human primates, pets that we may have around. That's where the potential contact can come about. And once it gets to human, the human-to-human contact is going to be as a result of a close contact, which means if you become exposed to the rash, that is one of the characteristics of the disease, to bodily fluids, which can be blood, secretions, fluid from the lesions, pus coming from the lesions. And now we know that contaminated materials such as that may have been used by the infected person, the bedding, clothing, or even the cooking, eating utensils that the infected person uses, it's not properly washed, we come into contact with it, it can pass the infection like that. So it's close contact that we're looking at. We know also that in pregnancy, it can be a case of a transmission from in the placenta from the mother to the fetus and at delivery because of contact with bodily fluids. And what is still being investigated in the current outbreak is what role asymptomatic cases in humans would have, which means somebody that has no symptom, no visible lesion, whether they would be able to pass it on to other humans. It seems that is a possibility. And I wanted to flag this particular situation. You can call it a case study, what has happened in the UK since May of 2022, because this is what is driving the numbers in some other countries. More than 500 cases. This is data up to 2 weeks ago, almost exclusively in the gay, bisexual, men having sex with other men community, with an age range of 20 to 60. 20% of those were persons who have HIV. And the link there, close contact, is there are often multiple partners, with close contact, sexual encounters, so to speak. That's what seems to be driving epidemic in most European countries now. They have also had other STIs, sexually transmitted infections. Monkeypox is not an STI, but people would have had.
Oh, sound cut out. No.
Okay, a little bit gross, but I just wanted to flag the different types of lesions that you can find in the mucosal and genital area. And this other slide from the New England Journal of Medicine highlights the types of lesions that you can have. You can notice that some of those lesions may mimic even the chicken pox that we traditionally have. So the discussion that this brings about is how we engage our community to ensure that we don't have cases spreading as wide as they are in other countries, whether we will need any special measures for people with HIV, how do we protect our frontline healthcare workers once cases start to show up with us, sexual transmission and its role, asymptomatic transmission, as I had mentioned. And I know there's a discussion about vaccines. I do know that in discussions with Pavo, last week. It's not so easy to get. Cost will hover around 100 US per dose, and you need 2 doses. And of course, you can't really be vaccinating the entire population. So countries will have to make a determination in terms of that. So prevention is always going to be the particular situation that you have to look out, particularly for monkeypox. So that's my presentation. And it's something that we definitely need to be on the lookout as we have to deal with another situation in that clearly articulates the One Health situation that we have in country.